I am Naomi, currently residing in Plantation, Florida. I am currently a mortician, licensed funeral director for the state of Florida. I am a mother to a 3-year-old. My son has been diagnosed with autism at the age of 16 months. Currently, at 3 years old, he does not eat solid foods. And then, even at school, he does not eat the food that is provided to him at lunch, which has caused a huge distress for me because I'm not really to be really having that support needed from the school system or having that support to assist and give him therapy for his eating issue, but also to assist him with the other OT and PT aspects that my son is having difficulties in. As of today, he does not have any insurance because we were deemed that we made too much in order for him to receive assistance. And my son is in need for therapy. He currently needs occupational therapy, speech and feeding therapy, physical therapy, ABA as well. So in December of 2022, Social Security Administration deemed my son as disabled from all of the doctor's reports that we provided from his neurologist and different other healthcare providers that we were seeking assistance. I came across early steps from his daycare about probably assisting with therapy sessions. I signed my son up at the age of 16 months, and we started occupational therapy, speech and feeding therapy, physical therapy, infant, toddler, infant specialist, and a nutritionist. So, 5 to 6 different specialists at 1 week. And as a total, my son was getting almost 10 hours a week of services, so 40 hours a month, which was helping us see a lot of improvement. Social Security also advised for me to enroll my son into Children Medical Services, which is CMS. And I had my own social worker who got a chance to understand my needs and the process that I needed for my son. And we built a relationship on the day-to-day activities that my son was receiving. So as of today, Social Security had deemed that my son was no longer eligible for Medicaid or Social Security benefits. And so I reached out to KidCare to see how I can assist my son with getting therapy. And one of the things that they had said is that some of the therapies they don't offer based off that service, right? But my son still needs healthcare. And when I tried to apply for it, it was going to be $500 a month. And so pretty much as of today, my son has no insurance, and I'm having to not be able to afford therapy because it's extremely high, as well as for him to even see his primary care provider because he does not have any insurance or health coverage for himself. It's so frustrating to me as a first-time mom, on one income parent coming into the home trying to have things copacetic and things in a well balanced, and it's really, really hard. And which is causing me to really be in a financial crunch because I have to decide whether I neglect a bill to make sure that my son's well-being is well taken care of. And currently at this time, we are so behind on our bills. Like I mentioned, as a huge advocate for my son, I don't want him to lack because of the finances, but it's starting to become a big burden where there's times where if I miss a bill, I take care of him, then I have to miss his opportunities because I have to take a bill because I want to make sure that we are safe at home and protected. I would say to the legislators, someone like myself, I have proof that my son is disabled. I have reports. I have doctor's notes to reflect on the day-to-day activities and of someone of unique abilities. And it's sad to say that legislation hasn't put in place that you have to meet a particular quota in order to receive those benefits. But what about those individuals who are really working hard, trying to make ends meet and still being shut down, and which is causing a big hurting for not just the individual, the caretaker, but what about the child? And it's like a child who really can't speak for themselves. As a parent, I'm asking legislators to look into the heart of the children that needs this, who really needs the support. Even with Florida KidCare, it doesn't have all the benefits to help. It's saddened to see that someone like myself or my son who doesn't have the benefits because of income being a stricture of a factor, and then having to being able to not have my son to have a full life because he needs the opportunities to succeed in life, and he's not getting that. And so if I could have that opportunity, this will make it will make my world round, and it will bring tears to my eyes because I have individuals who are trained to specialize in someone like my son and his developmental disability to help guide that process. And we do it all together as a whole.